Hi, this is Dr. Nancy Tierney, and I'd like to welcome you to NU621 Advanced Pathophysiology Week 2 video recording. This video will introduce you to the recent changes in standards of care that the American Diabetes Association has made. So let's get started. They have made some general changes and some more specific ones, and both of these will be addressed in this video. The recent changes that are much more general that have been made to the guidelines start out with a change that the American Heart Association has made in their recommendations, as well as other associations, and that is to encourage the individuals to be more physically active during the day. Particular focus is now on the individuals who sit for 90 minutes or more at a time. Most recent research, which has just been reported in the news media also, is that if you sit for 90 minutes or more at a time, or you sit the majority of the day, that any exercise you do during that day will be negated. In other words, the effects of the exercise that you are doing will not benefit you if you sit for the majority of the day. So this is something that you can review with your patients when you're going over just any information that you give at any visit, but particular interest to the patients with type 1 or type 2 diabetes. The second recommendation has to do with the popular e-cigarettes. The American Diabetes Association has taken the most recent research findings and translated them into their guidelines. The most recent findings about e-cigarettes have shown that they are not proven to be useful in either smoking cessation or as a safe alternative to cigarettes. So their recommendation from the American Diabetes Association is to not recommend the use of e-cigarettes as an alternative to smoking. The next general change that has been proposed is a change in the diastolic blood pressure target. Previously, the diastolic blood pressure target was 80. It has since been raised to 90. These recommendations come from the guidelines and the information that has been put forth by the Joint National Committee, or JNC8, having to do with hypertension. What JNC8 has proposed, based on recent research, is that a blood pressure now of 140/90 is acceptable. So the American Diabetes Association went along with those guidelines, and they raised their target diastolic blood pressure to 90. And the last general change that has been proposed by the American Diabetes Association has to do with blood glucose levels pre-meal. Previously, their target recommendation was a value of 70 to 130. The new recommendation is now that the blood glucose level pre-meal, it has been raised to 80 to 130 for the range. Specific lipid recommendations have also changed in the standards of care for the American Diabetes Association. In general, the American Diabetes Association recommends following the current lipid recommendations from the American College of Cardiology and the American Heart Association guidelines that were published in 2013, which were reviewed in a previous video. Two places where the American Diabetes Association deviates from the 2013 ACC-AHA lipid guidelines has to do with simplification of patient identification. The American Diabetes Association has recommended that you divide patients into just two groups: those who are less than 40 years of age and those who are 40 years of age or more. This is a simpler grouping and recommendation than the four groups that the ACC and AHA have recommended. The American Diabetes Association also does not recommend the use of the cardiovascular risk calculator. They prefer to look just at an individual's risk factors. So you will do a risk factor profile on all of your patients, diabetic or non-diabetic. You're going to look at things such as the low density lipoprotein or LDL cholesterol, and is it over 100? Is the individual overweight or obese? And in order to document that, you can use the BMI calculations. Do they smoke? And do they have hypertension? So using these risk factor calculations is going to simplify things for your diabetic patients. Other specific lipid recommendations has to do with the use of statin therapy. If you recall from the previous video on lipid recommendations from the ACC-AHA, they divided statin therapy into two groups: moderate intensity statin therapy or high intensity statin therapy. The American Diabetes Association in general has changed their recommendation to moderate intensity statin therapy for those patients that are at risk or have disease, such as diabetes. However, the American Diabetes Association says that if there is proven atherosclerotic disease, such as coronary artery disease, then the recommendation is to use high-intensity statin therapy. If your patients are statin intolerant, you go with the American College of Cardiology, American Heart Association recommendations. This includes adding ezetimibe or Zetia, or using another monotherapy agent, such as bile acid sequestrants. The American Diabetes Association also stresses the importance of lifestyle modifications, especially for younger at-risk patients. Again, preventing diseases from occurring and modifying the disease process in those who already have diabetes. Special consideration is given in the lipid recommendations for women of childbearing years. The discussion that you need to have with your patients in the office is this woman of childbearing age, and is she interested in becoming pregnant? You must balance the risk-benefit ratio with the use of statin therapy in women of childbearing years. And this applies to all patients with diabetes, whether it's type 1 or type 2. I'm just going to give you a quick review of high-intensity statin therapy, which is atorvastatin 40 to 80 milligrams a day, which is Lipitor, or rosuvastatin, which is Crestor, at 20 to 40 milligrams per day. And the dose you choose to start with will depend on the risk factor profile that you calculate. Moderate intensity statin therapy is these medications at these doses. There are apps that are available for your smartphones and your tablets that have this information readily available so that you don't have to memorize it or carry it around in your pocket on a sheet of paper. Thank you for your attention. If you have any questions, please don't hesitate to contact me through Blackboard or through my cell phone.